special show on COVID. Now, this is the campaign by Mirror now, where we have told our viewers, where we advise our viewers to not lower their guard. And that is the big focus of this hour. In the rise of COVID cases across India, after a gap of 3 months, India has now seen a biggest COVID spike. Over 8,000 fresh COVID cases and 10 deaths have been recorded across the country. India's active caseload is over 40,000 now. Of all the states, Maharashtra and Kerala have reported the highest COVID cases. With the uptick in caseload, many are asking if the fourth COVID wave is around the corner. Joining me right now is Dr. Sanjith Saseedharan, Consultant and Head Critical Care at SL Raheja Hospital, Dr. Satyanarayana Mysore, HOD and Consultant Pulmonology Lung Transplant Physician at Manipal Hospital, and Dr. N.K. Mehra, former Dean of AIIMS. Thank you so much, gentlemen, for sparing your time and speaking to Mirror now. Appreciate that. Dr. Mehra, I'd like to come to you first. So talking about, over 8,000 plus COVID cases across the country. Now, Maharashtra, Delhi, Karnataka and Kerala are the states of concern here. Karnataka government has made masks mandatory. The Maharashtra government has advised citizens to wear masks, although it's not a compulsion yet. Do you think more states should follow suit? Is it time to amend our COVID protocols?
Yeah, Charlene, thank you so much for having me here. I know that the numbers are increasing, and if you look at the John Hopkins dashboard and look at the 28-day numbers all over actually the globe, the numbers are still very less in India. I'm not saying that you don't have to be careful, but the hype about mask coming for everybody and all that, I think that may be a little too much at this point of time. However, I'm very keen that the mask should become mandatory for those who are immunocompromised. Immunocompromised are the people who are more likely to develop the infection. So to people who have had a transplant, people of cancer who are on drugs, those with diabetes and the primary immunodeficiency disease, there's a number of them. And that makes the number very, very, very large. I think for them, the mandatory mask is a must. They should not go out without the mask. You see that the numbers were dropping down so very well, and we were all thinking that we have now come to the endemic stage. After all, the endemic stage has to come. And we have to also understand that the virus is not going to go away. So we have to find a balance of making sure that our life also goes on and on. Closing schools or making mandate masks for everybody and all that, I don't think that's going to work, because we look at the numbers in the US and the daily numbers are about 9 to 10 lakhs a day. And then and in Europe and all that, there are a lot of countries where there are 40,000 or so per day. So I don't think there's anything to worry about, because the hospitalization, the number of severe infections or the number of deaths is still very, very low. This virus, the BA2 of the Omicron, is not very, very severe. It causes infection like any other common cold virus infection. However, we have to be careful when we are in open and in a crowded area. Then, of course, it will be in your interest to sort of wear the mask. Some people have asked me, is one-way mask okay? Yes, of course, one-way mask is also okay if you are immunodeficient and if you're in a very crowded place. Then I think a good, well-fitting mask, maybe the N95 and all that, they will be very good.
Right. You spoke about, sub-variants here, and let me take this point across to Dr. Saseedharan. Doctor, COVID cases are rising again, and this phenomenon is not specific to India. Dr. Mehra did give example of the US and Europe. We're seeing a surge in the US too that's powered by a rising tide of Omicron sub-variants. Do you think these sub-variants, especially BA4 and BA5, are responsible for the spike in India currently?
So, see, first of all, futuristically speaking, I feel it's the current coverage of the vaccines, that is important, that we must understand. See, the currently available vaccines have actually a very modest effectiveness against mild infection and transmission. And that is what we are seeing, mild infection and transmission, which is further reduced in the context of, newly emerging Omicrons like variants that you just now said, BA4 and BA5. So hence to slow down the circulation of this particular virus and to limit the spread and emergence at which variants emerge, we need to have a new vaccine, I feel, in the first place. A vaccine that will give a long-lasting cross immunity against SARS-CoV-2 variants, confers a longer duration of protection. So we know very well that after 20 odd weeks, the immunity wanes to an alarmingly low level. In fact, there have been situations where laboratories has actually revealed absolute absence of neutralizing antibodies at somewhere around 20 weeks. And our boosters have to be given much earlier than that. In fact, the UK has now reduced the booster duration to somewhere around 3 months. So yes, variants will emerge. Variants are responsible for transmission of mild illness. But I again reiterate the fact that severe diseases are still kept at bay because of the vaccination. Albeit, I feel that the vaccination booster has to be done much more earlier, or we need to engineer a new vaccine. And I think that's the take home. I feel the next generation of COVID-19 vaccines will need to be better, and they should have best long-term solution.
Right. So now that we are on the topic of booster doses, Dr. Satyanarayana, I want to ask this question to you. In April, the centre opened up the booster drive for all adults in India, while the government reduced the gap between the second and the third doses to 90 days for a certain section of population like those travelling overseas. For a large part, the gap is still 9 months. Do you think it's time the government expands its booster drive and reduce the time duration for all adults?
A small study was done at the Karnataka government level in the NIMANS laboratories. A look of the neutralizing antibodies, not the IgG antibodies that routinely all the labs test, specifically those antibodies which can knock out the virus. Now, roughly about 4 months from the date of immunization, whether it is booster or so, the antibody titers, that is the neutralizing antibody, will drop. Second aspect is, rather than trying to reduce the duration, I think COVID appropriate behavior is the most important, as the esteemed doctors opined just before me. Simple attention to mask can reduce the incidence, the increasing numbers, and may even abort a fourth wave. We have to we've reached a phase where we have to live with the virus. The virus will be like any other common cold virus, but then there should be no complacency and no misgivings about it. Need of the hour, abort the fourth wave, take your jabs. There are number of individuals who have not taken the second one, number of people who have not gone for the booster. With the pandemic fatigue, not only is the mask compromised, but also people, a wide section of the society is yet to go for the booster dosage. Once the booster dosage is covered by about 60 to 80%, that is when you look at the prospect of another wave or a surge, and then decide whether we should reduce the duration between the two vaccines. Thank you.
Right. Okay. So we need to see after the surge and then take a call if the duration has to be shortened or not. Dr. Mehra, I want to ask you a similar question. Now, I do understand that there is a 9-month gap between the last two doses. However, as of May 9th, and now this is according to news reports here, only about 2.1% of the total population of India took their booster dose. And this booster coverage is among the lowest globally. Why do you think India is falling behind, and what can the government do to galvanize beneficiaries?
Yeah, that is definitely a point that has to be stressed about. And I know I would like to highlight three issues. One, of course, is the vaccine. Today, India has already delivered 194 crores of vaccine, which means much of our adult population has already been fully vaccinated, which means 2 doses. But now, of course, the time has come for them to take the third dose. The number of people who have taken third dose is still very, very low, and this has to be increased. Increased through channels like you, through all kinds of suggestions made and advice given to everybody. And I think it is time that everybody, and that 9 months gap has also been now lowered to 6 months. People can even go after 6 months to the center, but they don't have their third dose. The third dose is then necessary now. The second, of course, the point is, the mask, and I already highlighted the mask for the immunocompromised people. People who are older and people who are immunocompromised, for them, it is a must. The third point, in terms of numbers are rising, and you said that there are about 8,300 in the last 24 hours, but when I saw the number of tests, the number of tests that we have done in the last 24 hours is about 3.5 lakhs. So our denominator is also increasing. People are actually going to the centers for getting their tests done. So once you get the test done, so testing has to increase. But one thing is very sure, when most of the people actually get a very milder form of infection, they're not going to the hospital, they're not going to be hospitalized and all that. So mask for the immunocompromised, vaccine for those who have now taken the third dose. And my third point is for the schools, make sure that their rooms are ventilated enough. The children where, the rooms that they go to, make sure that the rooms are really open, ventilated over there. I think these three things, if we follow, we will defeat the virus. Actually, the virus is not going to go away. We will have to adapt our life to the virus. Yeah.
Right. So an important advice there to always keep your rooms ventilated. Dr. Saseedharan, I would like you to come in here. While cases are rising, the brighter side is that the hospitalizations are relatively low. While there are protocols by the government on who needs hospitalization, according to you, when should a person consider getting admitted?
So it's the same as what we did in the course of the second day. We do a drop in office levels after the 6-minute walk test of more than 10 on your oxygen flow. That is one of the reasons as to why you should see hospital help as soon as possible. Importantly, those who are immunocompromised, who are comorbidly having diseases like diabetes, hypertension, obesity, and things like that.
Right. Okay. So there seems to be an audio problem. I'll let Dr. Saseedharan try to rectify the issue there. Let me come across to Dr. Satyanarayana. Doctor, here at Mirror now, we've been emphasizing the need to follow COVID-appropriate behavior, and Dr. Mehra also suggested how we need to keep our rooms ventilated. All of you all have been emphasizing the mask mandate for sure. But once again, for the benefit of our viewers, I'd like you to reiterate the hygiene rules, and I'm talking about the basic hygiene rules that one must follow to keep themselves protected.
Wonderful. Thank you for that question. And that is very important because this has been a process of learning for everyone involved, including the doctors to healthcare workers to scientists to general public. We know that beginning of the pandemic 2019, there was much too much emphasis on hand hygiene and things like that. Yes, they are important from preventing infections, common flu, influenza, and other things. With respect to COVID, definitely data is coming out strong on use of mask in public places, avoiding crowd, any surge in numbers, people and numbers, and that has to be correlated with if there is a trend towards increasing numbers, then better to avoid those things. And this will help to a large extent in preventing huge numbers. Fortunately, the symptoms are very mild. Therefore, the danger with that is very mild symptoms. I don't feel that I have virus and I may end up, walking into my household where I may have relatives with immunocompromised status or weak or elderly individuals or transplant patients. Therefore, till the numbers do go down again, a reverse quarantine needs to be done. If you have come from outside, ensure that you are not, if you have mild symptoms, do not neglect it and isolate yourself. And current isolation is 7 days, and it's not a much thing to ask.
Right.
This will avert draconian measures that may happen if we end up into a fourth wave.
Right. Dr. Satyanarayana, you've led me to a very crucial point, which is my next question, as you highlighted about not neglecting the symptoms. So monsoon is almost here, and Dr. Narayan, I want to ask you this as a follow-up question. Monsoon is almost here, and with this change of weather, people are prone to display flu-like symptoms. Your advice to those who perhaps assume that symptoms they are showing could be common cold or flu and tend to self-medicate. Dr. Satyanarayan, if you can hear me.
Yes. So instead of self-medicating, I think the symptoms, the mild symptoms due to Omicron variants, B1, BA1 to B5, very difficult to distinguish on clinical grounds. There are number of H1N1 patients who will mimic the same thing. Therefore, number of preventive things could be done. One, meet your doctor, find out if you should take the influenza vaccination, provided you meet the criteria for it. Second, do not neglect the symptoms. Third, isolate. And fourth, see your local health provider if there are symptoms. And this could be even a teleconsult at the best. And this will prevent any eventuality of hospitalization. As alluded to by the earlier doctor, the thing to look out is unrelenting fever over 6 to 7 days. If you are diabetic, any onset of breathlessness, any clinical signs that is worrisome, we should not even wait till such a time to seek a consultation in the first place.
Right.
Flu vaccination is need of the hour in those who qualify for that, and that based on the symptoms alone, not a precise science to distinguish between a common flu, H1N1, or the COVID mild infection.
Certainly an important point there, that consultation is the need of the hour if you are showing symptoms. Dr. Saseedharan is with me. There are many instances, Dr. Saseedharan, where COVID has been misunderstood as something else like common cold or flu, as we were discussing. Many people still hesitate doing a COVID test and continue their life assuming it's a common cold. In doing so, there may be, they may be able to recuperate from the virus, but forget that in the process, they are likely to transmit the virus to others. Therefore, I'd like to understand from you how assuming COVID is just assuming COVID is just a regular flu can actually be dangerous.
Yeah, absolutely. What you're saying, Charlene, is so important, because if you have something that resembles a flu, it could be COVID unless proved otherwise. And that's probably the reason. That's probably the reason that we should test. It's important to understand that you are going to transmit. That person whom you're transmitting may be the one who's above 65 years, maybe the one who's got a lung disease, maybe a heart disease, an obesity, maybe kidney failure, maybe diabetes, some weakened immune system patient, or maybe it's your own parent who might get this. And especially so if those patients, unfortunately, they're unvaccinated or partially vaccinated or pregnant, they might get extremely severe and also transmit it further. And that's what's going to cause the biggest issue. And that's the reason that you should get the test as quickly as possible, not only to protect yourself and others, and also to protect the community at large, because we will also know numbers, we will know epidemiology, we will know how we should be managing this particular problem on a population level.
Right. Also, I'd like to come across to Dr. Mehra there. In fact, I'm short on time, so one last word from Dr. Mehra. Experts have been saying that we need to learn to live with the virus. As COVID continues to be on the radar, every 6 months there's a new wave. Do you believe this could lead to a rather fickle future?
Well, if you look at the status in the in US, the New York now has a new strain. You can call it as a new strain. It's a new variant of BA2. It's called the BA2.12.1 because it has got 2 more mutations there over and above the BA2, and one of the mutations were also seen earlier in the Delta as well. So you might see as the virus keeps on dividing and all that, because the numbers in the US are really very large. They're seeing about 9 to 10 lakhs a day. And that's a very huge number over there. And you will see some of these happening if and all. And therefore, my caution is always to the immunocompromised lot that they are the ones who can be the first target of the virus. So they have to make sure that they don't. And we don't want the numbers to keep on growing. You know, your graph shows that in the last 5 or 6 days, there is a jump every day, and we will see how it goes because the number of tests are also rising. Mind it, there are a lot of tests that are done at home as well, and they're not being reported over there. So even though you're saying that the 8,000 or so each day, the number could actually be higher. But that's something that we have to learn to live with it. We have to make sure that we can protect ourselves. And I think our experts have given a very good advice in terms of the season of the virus, of the common cold coming now, that the people have to be very careful. They don't neglect any symptoms. Any symptoms should first be seen, could be due to COVID as well. So get your test done, whether at home or in a center there, and make sure that you don't have the COVID.
Takeaways there: wear your mask, get a booster dose, keep your rooms ventilated, follow basic hygiene, and most importantly, do not ignore flu-like symptoms. Go to your doctor, get a consultation, do a COVID test, and now it's as easy as doing a COVID test at home. All of these to be borne in mind during the season, where as now we're seeing a rise in COVID cases across India. Thank you so much, gentlemen, for sparing your time and speaking to Mirror now on this very critical issue. Thank you.
Thank you very much.
Well, on that note, it's time to slip into a short commercial break with news.